So there you go, Marie. Slides are in now. We can hear you, we can see you perfectly. So I will see you in 20 minutes and we'll do some questions.
Great, thank you. So hi everyone. Apologies, this is my first conference and my first talk, so I'm not sure how I'm gonna do, but I hope it's gonna go well. So I'm one of the clinical research nurse at Barts. I work around all Barts Trust, so Whipps Cross, Newham, Barts Mile End, and Royal London, and I work with ELOPE, so the East London Cardiovascular Disease Prevention Group, which I will go more in detail in a minute. And we develop a project that is the NHS staff cardiovascular disease health checks in partnership with Ortus-iHealth. So I will present to you the platform, the Ortus-iHealth platform today, and how we use it to deliver these staff health checks. So next slide, yeah. So, sorry, I went too far. All right. So the East London Cardiovascular Disease Prevention Group is a secondary-led program that we created to reduce premature cardiovascular disease mortality and health inequality in East London. We know that in East London, the cardiovascular disease is more prevalent than in the rest of London. So this is something that the NHS really wanted to focus on. So this group has 3 core aims. The first one is to develop and deliver cardiovascular disease prevention service within the trust, but as well in partnership with hospitals across North East London and with as well community groups. We collaborate with primary care to steer and deliver a cardiovascular prevention agenda for North East London. And we leverage our expertise to drive cardiovascular disease prevention effort in and with our communities. So we are quite a big group. We are mainly cardiologists, nurses, specialist nurses, pharmacists. We have public health people as well working. And so we have multiple projects. So the staff health checks is one of the projects in secondary care, but you can see that as well. We have an every contact project. Right now we're doing social prescribing as well. We're developing that. In primary care, we have pharmacists working on case finding for high-risk patients for AF, for example, and we have management and medication optimization. That's big work for pharmacists where they try to find out cases of AF that are not very well controlled with medication, but as well hypertension as well in community that are not reaching the targets. And in community, we do a lot of project and engagement. We are doing school talks, so we have a few nurses that go to East London school, and we do like a 20 to 30 minutes talk to kids to how they can keep their heart healthy. And the goal there is first of all, they're a bit more aware of how to keep their heart healthy, but as well they go back to home and they teach their parents how to change maybe their diet or how to be more physically active. So it's a really great project and kids loves it. We do work as well in CPR and early defibrillator training in the community, and we do work with some football teams at the moment. That's a project that we're doing with I think we were doing with Crystal Palace, if I'm not wrong, but that's something that we're developing. And we're doing health checks prevention and health checks day. For example, on Saturday, we're going to a mosque in Newham, where we're there all day and we just do blood pressure check and refer the people to their GP if we find a case of high blood pressure. So to come back to the main aims of staff cardiovascular disease health checks. So we have 3 main aims. So first is identify, undiagnosed and undertreated high blood pressure in NHS staff, ensure appropriate assessment and treatment, and follow-up option for monitoring and treatment of high blood pressure through a co-produced framework, and then explore opportunity in addressing other modifiable cardiovascular risks, so such as obesity, smoking, drinking, lack of physical exercise, by signposting the staff to complementary local services. So we do work as well with a smoking cessation clinic. We do work with the wellbeing lead in each trust site. because they usually offer quite a lot of free, for example, yoga classes or Pilates classes or social event or talks on healthy eating. So this is very collaborative project. So this is a project that started in 2021. This is mainly from a cardiologist from Newham and as well from Barts. And we did a pilot and we discussed why we were going to focus on NHS staff. So in the UK, we believe that 1 in 8 people have undiagnosed or undertreated high blood pressure, which put them more at risk of any heart attack or strokes. And the NHS, we know it's the largest employer in the UK with an average in our trust of 10,000 staff. So that, in calculation, that's around 700 staff will have undiagnosed hypertension and around 500 staff will have undertreated hypertension. So this is really why we wanted to focus on NHS staff. As well, on part of this, most of our staff lives in East London, so that will touch the right population. And we know that a lot of staff in the NHS are in the low-income group too, so that's quite important. This is as well an opportunity for NHS organization to be exemplar, so to show that they remember that we do care, that we do have facility that are easily accessible and that we can spread around the workplace, that we do care about the staff, and this is quite important since the COVID pandemic. There is a big emphasis on mental health being, but I think we do forget about physical health as well. It's quite important. We do know how difficult sometimes it is to get an appointment with your GP. And I think a lot of staff, this is quite a bit feedback from staff that they do struggle to get the GP appointment, especially when you work shift and you're stuck in a ward. So this is quite a good and helpful health check that they can have. And as well, one of the main goals as well is to reducing staff sickness and reliance to bank shift and bank staff. So this is a main project that we have at the moment, but as well to improve staff retention, engagement, and motivation. So what is our appointment? So at the moment, we have a nurse. So I'm working with her. She's a Band 5 nurse specialist in cardiovascular disease prevention. She works around all trust sites, as I say, and we do create clinics. And with the help of Ortus, we have create clinics where they can scan a QR code or click on the link and see when is the next clinic available. For example, on the screen, you can see in Barts, and they can click on the day they wish to attend and the time they wish to attend. From there will be basically a questionnaire that they have to fill in, where they fill all their past medical history and all their family past medical history. So we already know all of that, and we have all the important questions that we need to know. We do know as well, we ask them if they're smoking, what they're drinking, how much they're exercising, if they have blood pressure, if they're already on treatment or anything like this. Then comes the day of the appointment. It's a 15-minute appointment, so it's quite quick, so that allows them to be able to come, because we know wards are busy, so that really allows them just to take like 15 minutes and be covered by someone. We usually come straight in the ward. We work with some of the wards, and we are based in the ward, so it's easy for them to attend. They consult with us. We take the blood pressure. So we usually take a first blood pressure. If the blood pressure is normal and within range, we usually just discharge them with lifestyle advice. So we will talk to them a lot about diet, how to have a heart-healthy diet, how to control their cholesterol. We do talk as well about exercising. And if the blood pressure comes back out of range, we do repeat the blood pressure another 2 times. If the blood pressure is still high there, we offer a blood pressure machine for free. So this is thanks to the Blood charity. We managed to purchase some blood pressure monitoring. So we do give them a blood pressure monitoring so they can check their blood pressure at home for 7 days, morning and evening. They do send them the result when it's done. We analyze the result, and then we do a follow-up appointment. And usually, if the blood pressure is out of range, we refer them back to the GP. We send a referral letter to the GP. so they can see the GP and have an action plan basically. Either they will have their treatment adjusted or review, or either they will discuss with GP if it needs to be started on any kind of medication. So yes, that's basically the main route that we have for this cardiovascular disease health checks. So the consultation, as I said, I already went through it, but we do take height and weight too. We do calculate the BMI, the blood pressure. As I say, I explained to you already, but we do check the heart rhythm as well, so AF pulse checks. We calculate heart age and Q risk too. The heart age is more, I think, for some people it's more easy to understand, okay, your heart age is 10 years older than what you are because at the moment you may be a bit unfit. So it's really helpful for that. The Q risk is more for us to know, like, do they need to be referred to the GP? Like is that, if it's something relevant basically. And as I say, we do talk about lifestyle advice, smoking cessation, alcohol consumption. So this is on the right, you can see the Ortus app that are helping us to do that. They create this great questionnaire that we can just fill in quickly during the appointment, and it's very straightforward, and we can just tick whatever we need. So at the end of the appointment, we Ortus have created this great email that is sent to the people. So this is, you can see it's just a test there, but they will have all their know your numbers. So they will have all the height and weight, BMI, and as well their blood pressure and heart rhythm, and the estimate heart age. We used to do cholesterol readings, but unfortunately this is a very big, we need fridges and it's quite expensive. So we did stop at the moment because we did have some trouble with strips, but it might be something that will start in the future again. And then on the right, this is the second page of the email they receive. They have basically more links about the high blood pressure and what we aim for blood pressure. But as well, we do tick the goal. So here I tick every goal. I assume that I just pretend that they needed to be more physically active, have a more balanced diet, stop smoking, and don't drink too much. So there is a recommendation in the middle, but as well there is more links offered to them so they can go read on their own time and decide what to do as well. So from the data collection we have, then Ortus send us all the data dump and we do the cleaning of that. So mainly what we can say from the ethnicity, we're mainly focusing on the BAM population, and we have, this is quite representative actually of the BATS demographics, so we right on point on that. We as well, you can see for the occupation is mostly admin and nurses and healthcare assistant and allied healthcare, so it's quite the low income. We have mostly female because we know that healthcare are mostly predominantly female jobs, and we know there is a health gap for gender health gap, so that's quite good as actually we're seeing a lot of women too. On the rest of the data collection regarding how healthy is our NHS staff at the moment, so around 63% of our staff have an unhealthy BMI and 62% of the staff do not exercise enough. So that's where we do tailor diet and physical advice. So we usually take a bit of time to discuss about diet because it's very specific to each person. We have a lot of people that come from Asia that have a different diet. So we usually, me and the other nurse, we did do a training in diet and nutrition. So we are able to help them about that. And we do help them, encourage them to lose a bit of weight and to be a bit more physically active. But this is where you really need to personalize your advice, because obviously you have some people that maybe have back issues or any kind of motor problem. So you do have to make sure you give the right advice to them. That can be just walking. We tell them like walking or doing gardening, that counts. Some people do not have money to go to the gym, so we do tell them what's available and free at the hospital too. We only have around 6% of the staff that are smoking, But out of the 6%, 60% accepted to be referred to smoking cessation clinic, which is great. We do follow them up after in later time, but at the moment, we don't have the data yet on how many have stopped. Regarding blood pressure findings, at the moment, we saw around 406 staff, and 16% of the staff were found to have elevated blood pressure. And there is really a 50-50% gap there. Out of the 16%, 8% were already treated for hypertension, and the rest are on blood pressure. So those people were asked to do 7 days on blood pressure. And on review by our team, 60% of them continue to have high blood pressure at home. So, and out of the 60%, 52 were referred to their GP for further management. So quite a significant number there that were referred back to the GP. And some of them, we had some feedback. Some of them were started on medication. Some of them did have their treatment change. So as you can see, it's a growing project. This is from our collaboration with Ortus. So since Ortus in just 2022, you can see at the beginning there were no nurses doing this program. So it was based on like some nurses that had some free time that could do it. But I've started in March 2023. So when I was alone, I was able to do 4 to 6 clinics a month. And now we have Liz, one of the nurses that is full-time in doing that. So this month we've done 14 clinics and we've seen 169 staffs, which is great. Some of the feedback. So on qualitative feedback, 79% of the staff say that this service that we provide make them feel more valued as an employee, which is really important. As we say, we want to try to have more retention in Bart's Trust. This is really one of the areas we need to focus on. 76% of the staff will be more prone to positively change their physical activity, and 88% of the staff will be motivated to make positive change about their diet following their appointment. So it's quite a significant number. On the right, you can read there is a few. This is quite nice feedback that we had from 2 staff that were really happy, and they emailed me like a few months later saying what happened to them, which is really nice actually, and hear from them. So we've been nominated for 2 awards. So actually next week we are going to speak in front of the SAG jury to present a bit more in detail our project, and we are as well for Nursing Time Workforce Summit Awards. So that's really exciting, and we're really happy and proud that we got nominated for the Staff Wellbeing basically award. Thank you for listening. I hope that was quite clear. There is the contact of the Ortus team here as well, but you can ask my contact too if you have any question about our project. I think that's it.
Hi Marie, can you hear me okay?
Yes.
Well, firstly, congratulations on your award nominations. How exciting that is. If you've got a couple of minutes, Marie, we'll just go through a few questions, if that's all right?
Yes, that's fine.
Absolutely amazing. Well, just started us off here. Let me just check who this was. I think it was John. So yeah, John's asked, do these health checks qualify for NHS health checks when possible, and do you get the funding for this?
Sorry, I have a poll that just opened, so I can't see.
That's fine, Marie. That's just for the delegates.
Okay, fine. Sorry, can you repeat the question?
Yes, of course. Do these health checks qualify for NHS health checks when possible, and do you get the funding for this?
So the NHS health checks that people qualified for is a bit more detailed than what we do. We just do basically a blood pressure clinic. A lot of staff do not know that they qualified for NHS health checks, so we do remind them that they're able to access it and have access to it if they need. So that's a reminder that we give to people, but yeah, we always advise them to do it on the top of what we do. For the funding, we go through Bart's charity. It's mainly the Bart's charity that funds us. We do work with Nuffield as well, which is a private healthcare. They did fund my role, basically. They do quite, so we work with them because they give health checks for band 3 and 4, if I'm not wrong. And they're a bit more detailed health checks that we do. They do cholesterol checks, H1BC checks, they do body fat checks and all this kind of stuff. So it's more in detail than what we're doing. But we have a bit of funding from everywhere, but mostly about charity.
Yeah, and someone just asked, again, another funding related question, but was it funded through the trust in terms of finances and resources, or was it through NHS England CVD prevention funding via the ICB?
No, it was mainly from the trust. So it's mainly from the trust, yeah. We don't have from the NHS.
Not a problem at all. And another question here from Pauline. Does the digital platform facilitate ongoing assessments and engagement with the NHS staff to ensure that they continue to make progress in improving their cardiovascular health? So is there any follow-ups from there?
Yeah, so we do have a follow-up for people that, as I say, have high blood pressure. We do follow up with them using the Ortus. They can usually use it to put all their blood pressure, so we can follow them from, on distance, basically see how their blood pressure is doing and everything. For staff that not have high blood pressure, we do ask them to fill in questionnaire after 6 months to see how they're doing, to see if they have any new issue. We do ask them if they want to come back, they can always come back. So we had staff that I've seen already 2 or 3 times that come back every 2 or 3 months to have their blood pressure checked. And because we use the same Ortus platform, we can basically compare from one month to the other if they've lost some weight, if their blood pressure improved, or if they're more physically active. So that's great for that.
Absolutely brilliant. Well, Marie, it's been an absolute pleasure having you on board with us. Really appreciate that. We'll get the slide shared afterwards as well, and we wish you the best of luck with the upcoming award nomination.
Thank you very much.
Thank you, Marie. Take care. Have a great afternoon.